Hello, I'm Dr. Steve Johnson. In this video, I want to talk about metaphorical disputes in Rational Emotive Behavior Therapy, or REBT, what they are, how they work, and when to use them carefully. Let's begin with the foundation. In REBT, disputing serves one core function: to challenge and modify irrational beliefs at the B point of the ABC model. Remember, A is the activating event, B is the belief, C is the emotional and behavioral consequence. It is not the event that creates the disturbance. It is the belief about the event. So disputing is not arguing for argument's sake. It is a structured, purposeful intervention aimed at helping clients identify irrational beliefs, evaluate their validity, replace them with rational, flexible, reality-based alternatives. The goal is not comfort. The goal is cognitive and emotional freedom. All forms of disputing share the same goal: to weaken irrational beliefs and strengthen rational beliefs, but they differ in method. Let's briefly review several forms. Pragmatic disputing asks, is this belief helping you? Does it work? Does it move you toward your goals? Empirical disputing asks, where is the evidence? Is this belief supported by reality? Logical disputing asks, does this belief logically follow? Are we confusing preference with necessity? Are we turning I want into I must? Friendship disputing uses warmth and alliance. It may sound like, if someone you love said this about themselves, what would you say? Humorous disputing gently exposes the exaggeration in irrational beliefs. For example, turning this is awful into so. Is this worse than the collapse of civilization? And then we have metaphorical disputing. Metaphorical disputing uses imagery, analogy, or symbolic language to illuminate the irrational belief. Instead of confronting the belief head-on, we step sideways. We create distance. We invite perspective. For example, a client says, I failed. That proves I'm worthless. A metaphorical dispute might be, if you dent your car, does that mean the car has no engine, no value, and belongs in a junkyard? Or, if a tree loses leaves in winter, does it become a worthless tree? The metaphor reframes the belief without directly attacking the client. It helps them see their thinking from a new vantage point. A metaphorical dispute typically follows this structure. 1. Identify the irrational belief clearly. 2. Extract the core distortion, usually a demand, awfulizing, low frustration tolerance, or global rating. 3. Construct an analogy that mirrors the structure of the distortion. 4. Invite the client to evaluate the metaphor. 5. Then gently map the insight back to their own belief. The movement is belief, metaphor, insight, return to belief, rational alternative. The therapist must make the bridge explicit. Otherwise, the metaphor becomes clever, but not therapeutic. Metaphorical disputing has several strengths. First, it lowers defensiveness. Clients often resist direct logical challenge, but respond to story and image. Second, it activates emotional learning. Metaphors are processed differently in the brain than abstract logic. They engage imagination, memory, and affect. Third, it enhances recall. Clients remember metaphors long after they forget syllogisms. Fourth, it respects complexity. Some beliefs are rigid, not because they are illogical, but because they are emotionally fused with identity. Metaphor can loosen that fusion. However, metaphorical disputing requires skill. A poorly chosen metaphor can feel minimizing, miss the emotional tone, seem patronizing, or derail the session. It also risks oversimplification. Clients in acute trauma states, severe depression, or high emotional arousal may need stabilization and direct cognitive grounding before metaphor becomes useful. Metaphor should clarify, not distract. Metaphors are culturally embedded. A sports analogy may resonate with one client and mean nothing to another. A religious metaphor may inspire some and alienate others. Agricultural imagery may resonate deeply in one community and feel abstract in another. So the therapist must ask, what symbolic language lives in this client's world? Good metaphorical disputing uses the client's own imagery whenever possible. It is collaborative, not imposed. It can go awry when The therapist uses metaphor to avoid direct disputing. The metaphor becomes more important than the client's experience. The client feels misunderstood. The therapist fails to connect the metaphor back to the irrational belief. Humor crosses into ridicule, and most importantly, if the client interprets the metaphor as invalidating their suffering, the alliance weakens. Remember, REBT is direct, but it is never dismissive. At its core, metaphorical disputing is simply another path to the same destination, helping clients move from, "I must not fail, and if I do, I'm worthless," to, "I strongly prefer success, but failure does not define my worth." Metaphor does not replace logical or empirical disputing, it complements them. All disputing methods serve the same purpose: to weaken rigid demands, reduce global self-rating, and cultivate flexible, reality-based, self-accepting beliefs. In REBT, we are not merely arguing with thoughts. We are teaching people how to think about their thinking, and sometimes the most powerful way to do that is through a story. Thank you for joining me. If you want to go more in depth into REBT and its integration with other psychotherapy models, consider joining this YouTube channel, Psychotherapy Education and Training.